Hello. Today I'm going to talk to you about complementary and alternative medicine in GI and illnesses. My name is Anthony Lembo, and I'm a professor of medicine at Harvard Medical School and director of the GI Motility and Functional Bowel Disease Center at the Beth Israel Deaconess Medical Center in Boston, Massachusetts. Acupuncture is known to be a key component of traditional Chinese medicine. It works on patterns of energy flow or qi through the body that are felt to be essential to health. Disruptions of this flow are believed in TCM, or traditional Chinese medicine, to be responsible for diseases. Then imbalances in the qi flow can be corrected at identifiable anatomical locations, in other words, acupuncture points, or by herbs, which is another common traditional Chinese medicine. And oftentimes they're used actually together. There are many acupuncturists in the United States. This is from a few years ago. We looked at the actual number. There was over 11,000 licensed acupuncturists in the United States. And you should know that these people go through rigorous training, and there's a 4-year master's degree education that's required before you can get your license to practice acupuncture. And if you are going to seek acupuncture, I always tell my patients to make sure that they ensure that their acupuncturist is actually licensed in the United States. Interestingly, there are 3,000 medical doctors that also have undergone the degree to are licensed to practice acupuncture. And in this case, if you're a medical doctor, you have about 200 to 300 hours of special training in order to get the licensed acupuncture degree for this. Now, the basic principles of acupuncture involve 365 traditional acupuncture points on 14 main channels. These are also known as meridian. Shown here are some of the points. If you look at the figure on the right, on the upper right, are some of the key points along one meridian. And then on the lower part, you can see the different types of meridian: the stomach meridian, the liver meridian, etc. Each point has a defined therapeutic action. In a typical session, you use 5 to 15 needles. And the combination actually varies during the course of session. So typically what will happen is after 10 to 15 minutes, they'll move some of the needles around. After puncturing the skin, the needles are moved back and forth. They're typically left in place, as I stated, for about 15 to 20 minutes, and then they usually move to another position. There's also other modalities that are used along with acupuncture. This commonly includes massage therapy, cupping, which is shown on the right-hand side, heat or electrical stimulation. I'm going to show you a study in just a minute on the effect of electrical stimulation acupuncture on functional GI symptoms, as well as lifestyle counseling is also considered to be an important part of acupuncture. Now, there are a number of studies that have been conducted in the United States and elsewhere in the world with acupuncture in GI conditions. But it's important to remember that that conducting studies can be quite challenging in acupuncture. There's obviously some inherent biases by the acupuncturists who are participating in the study. This is just one way to think about this. This contrasts many of the treatments that we're typically used to seeing in clinical trials, that is with a pill or a procedure where it's just very specific. Acupuncturists tend to individualize treatment, so they may have their own inherent biases how things should go with a patient, which again can affect the results. It's very hard to have a sham control. There are standardized needles that are non-penetrating that are meant to mimic true acupuncture, but again, it's very difficult to do this. And obviously, the actual location that these sham needles should be placed is unclear. So there's a lot of differences in the type of sham controls, and it's hard to compare studies across different types of studies using different types of controls. There's a lot of heterogeneity in the type of acupuncture techniques. The actual points that are used will differ from acupuncturist to acupuncturist. And as I've already mentioned, acupuncturists like to individualize treatments according to the patterns of disease. And that would be something that's very difficult to incorporate into a randomized controlled trial, though it has been tried. And of course, there are a lot of non-specific effects that occur with acupuncture, which I'll show you in just a minute. The NIH consensus panel in 2002 met to review acupuncture for GI disorders, and they came up with some statements about the overall efficacy of acupuncture, which is quite interesting. They felt that there was sufficient evidence to support efficacy of acupuncture for nausea and vomiting, particularly post-operative and post-chemotherapy nausea, also nausea of pregnancy, post-op dental pain, and constipation. They felt that the quality or quantity of research evidence for other diseases are not sufficient to provide firm evidence for its use, and that includes IBS, inflammatory bowel disease, peptic ulcer disease, gastroparesis, among others. It's important to note, though, that in many instances, there just wasn't sufficient research to make a definitive conclusion about the efficacy of it. So as I alluded to earlier, I wanted to show you a particular study that was recently published. This is a very high quality study conducted in China across multiple sites in China, 15 centers in China. Patients were over 1,000 patients with functional constipation received 28 true or sham electroacupuncture treatments over 8 weeks. And in this study, the primary outcome was complete spontaneous bowel movements per week, the number per week, which is a very valid endpoint, one which we would use in some of our studies done in the United States with medications for functional constipation. If you look at the graph, you can see what happens after week 0, where they started acupuncture, that there's a significant improvement that occurs really by week 2, that there's a clear separation between those that receive electric acupuncture versus those that receive the sham electric acupuncture. In that sham electroacupuncture, there is an improvement, and that is what we call the placebo response. This is typical of what we would see in a constipation trial, even with a placebo pill. But you can see there's clear superiority with electroacupuncture, and that this effect was persistent beyond the 8 weeks of treatment, and they followed patients for up to 20 weeks. So you had a long-standing benefit from this electroacupuncture. So this may be a valid a viable treatment for patients looking for acupuncture. IBS is probably the most commonly studied treatment for acupuncture in the GI world. This is one meta-analysis that looked at 17 randomized controlled trials. They did not find overall benefit for IBS symptom improvement or quality of life compared to sham acupuncture, but they did find it was better than controlled medical therapy or no specific therapy. And there's also an interesting study looking at the effects of acupuncture on rectal perception and did not see a significant improvement in sensation. This is a study that we actually conducted a few years ago, and I want to highlight a few important points. This was a large single-center trial looking at over 260 IBS patients, all subtypes. This was part of another trial where they had a 3-week run-in of sham acupuncture, and then after the 3 weeks, they were randomized to 3 more weeks of either continued sham acupuncture or true acupuncture. This was sham acupuncture was with a non-penetrating needle on non-meridian points, so they were adjacent to these points. And we also had an important group, a waitlist control group that did not have any visits during this period of time. So they did not control for the practitioner-patient interaction, but it did control for the non-specific effects of coming into a clinical trial. And if you look at the graph, these are 2 global measures, so total global improvement and adequate relief of IBS symptoms. And if you look at the graph to the left that has the p-values, you can see sham acupuncture compared to true acupuncture, the p-value is 0.25, and you would need a p-value of less than 0.05 in order to be considered statistically significant. There was a numeric improvement of about 9%, but again, did not meet statistical significance. The other thing to note is the difference between sham acupuncture and waitlist control. Now, there was a significant difference with a p-value of less than 0.05. And if you look at adequate relief, we see a fairly similar rate between acupuncture and sham acupuncture. And again, there was a significant difference between sham acupuncture and weightless. What this tells you is that sham acupuncture, as well as acupuncture, makes patients feel better, at least with regard to this study in IBS. Because it was clearly better than the wait list of doing no intervention. So some of these effects are related to the practitioner-patient interaction. And there may be a small effect from acupuncture. If we wanted to really prove that acupuncture was effective, we would have needed to do a much larger trial, including over 500 patients in order to power this study appropriately. So thank you very much for your time and appreciate your attending.